Hi, I'm Dr. Stefana Pecher, the Country Doc. Welcome to our 6th edition of High Stakes, a series dedicated to helping our community navigate through this opioid crisis that we find ourselves in. We like to offer various holistic strategies and like to introduce practitioners that can be of assistance. I'd like to introduce Julie Banks, who is on our panel. She is an emotional freedom technique coach and also a holistic health coach. Our two very special guests today are from Aware Recovery Care in North Haven. I'd like to welcome Ann Webster, holistic nurse, and she's also the director of nursing at Aware Recovery Care. And we'll get a little more into your background and in a few minutes. I'd also like to introduce Dorothy DeNigris, who is also a holistic nurse and holds a high function at Aware Recovery Care. So welcome, ladies. Thank you for joining us today.
Thank you. It's great being here.
Wonderful. Well, Anne, tell me a little bit about yourself, just so we get to know you a little bit, your background.
Okay. I am a holistic nurse, and I came to nursing as a second career a little bit later in life. I graduated from nursing school in 2011. Before that, I raised children for a bunch of years, and I worked in nuclear industry actually, doing business development. So always wanted to be a nurse, and the 2008 financial crisis really was a wake-up call for me. And so I jumped off the diving board and went to nursing school, and then very quickly found my way into the holistic nursing path, and found myself in and around addiction everywhere I went. In my hospital experience, I was in and around addiction. The floor that we were on, I was on, our number one admitting diagnosis was an alcohol-related illness. Then I worked at a community health center where we served the uninsured and underinsured. And there, again, I found myself in working with people who were struggling with substance abuse and addiction. And I found my way to this amazing startup company, Aware Recovery Care. I met the founder at a networking breakfast. And Aware Recovery Care is an alternative, a brand new model of care for substance abuse treatment. So instead of sending people away to treatment, we go into their home and treat them for a full year. So I am the first full-time nurse that was hired, and my job was to develop the role of the nurse, now care coordinator at Aware Recovery Care. So I've been having a lot of fun doing that. 3 years ago, it was just me driving around the state of Connecticut, working with clients, and now we have 19 nurses and social workers that I manage, so we're growing rapidly. And it's a fabulous model, new model, and very exciting.
Well, we'll get into that a little more in a little more detail. Dorothy, tell us what you do at Aware Recovery Care.
I've been a nurse for 35 years, and working in various specialties. And I feel like I bring a little bit of all that to Aware Recovery Care. I'm a care coordinator. I work as part of a team of 3, and I actually go out into the community, and I visit clients. I have a client caseload, and I actually visit clients and help them navigating the needs that they need for their wellness for the year that we're in the home. I work with a team of 2 recovery advisors who are both in recovery. One of the beautiful things I think about Aware Recovery Care is that the recovery advisors who get really close to the clients, they are in recovery themselves. So they have a very intimate and close understanding of what the client is experiencing. So I met Anne a year and a half ago, and it's Aware Recovery Care, she said, is an innovative new model. We're in we're with the client for a year. And so we get to be in very close sacred space for that time.
So interesting. So you actually go into the home of the patient,
Yes.
and you spend 1 year with them.
Yes, yes. The home is the treatment center. That's what makes the model so different and so unique, is that we incorporate the family, we incorporate friends, the family dog. We work with the environment that the client, it's recovery in real life, basically. We help the client navigate a life of sobriety within the life that they live, their home, their job, their family. And we have an expectation that, and we welcome the family, and the family has a great deal of power, supportive power for the client. And they are everybody is considered a team member, which is a beautiful part of the program, which is why our success rate is pretty high.
So are you treating the entire underlying trauma and family dynamics within the whole family too? Because it's
We do.
often
Yeah.
linked.
We do. We have a very strong family component, family systems work. We bring in an LMFT to help us with family systems work. We also have a family education component. The client is visited by an educator. So, and that's done without the client. There are, I think it can go without saying that there are issues of codependency and enabling. And we need to approach those not from a punitive or judgmental point of view, but from an educational point of view, backed by, realizing that these are the people that love this person like crazy. And they want to be part of the team. They want to be helpers. And we teach them how to do that. We give them a sense of confidence and empowerment to work with us as a team. They get to learn about addiction and recovery along with the client. The end game being, after a year, we launch them into life with different skills, different perspective, and we've seen it. We've seen shifts in family dynamics that are just so humbling to me sometimes.
Yeah, if I could
And,
speak a
yeah,
little bit about
Tell
that.
tell us more.
Yeah, the family piece is really important. I'm glad you brought it up, Dorothy. In the beginning, a lot of clients, when they come to us, they've been in and around many different treatment programs. Very often, they've either left or been kicked out, or they've been in treatment and then they go home to the same old, friends and family structures, and relapse, and their lives kind of fall off. They fall off the rails a little bit. So when they come to us, pretty typically they have, there's a lot of failure that's happened, and there's a lot of fear. And the families really don't know what to do. And they're involved, they're touched, their lives. It's a family system problem, challenge. And so one of the things that we've been spending a lot of time in developing in our program is that family support that Dorothy was just speaking about. And the family education piece is really a way to say to the family, it's not your fault, and it's okay. We're here. We're here to support you, and we're here to support your son or daughter or husband or wife. It's okay. We may not have all the answers today, but we have a full year, to walk with you, to answer your questions. The family education piece introduces them. We talk a lot about how the first section, it's 4 different sessions. The first one is about the brain, and what happens, from a physiological standpoint and hormonally, what's going on in the body. And the second section is about, what is the family dynamic, and the genogram. We help them create a genogram so you can see and how that might, and it evokes conversation, and it's really a way of bringing the family and therefore the client into the whole treatment program, because we can't do it without them. It is a family challenge. Yeah.
That's very true. And how big is your team, and who is on your team? Give us a little overview.
That's a great question. So we have our medical director at the kind of the top. He's an addiction psychiatrist, Dr. Valandi Manohar. Has been in and around addiction for 45 years. Brilliant man. And every team member, so the client who comes to us is assigned an addiction psychiatrist. It may be Dr. Manohar, it may be someone else in the community, and that addiction psychiatrist does a full evaluation, really looking for co-occurring disorder, because we know that the client is going to have a much better chance in our program if we are addressing any underlying co-occurring disorders. So we take a look at that right up front. So that person becomes a member of the team. And then there's the care coordinator, and we use nurses and licensed clinical therapists, social workers rather. And then we have the certified recovery advisors. So they're people, men and women, that come to us with a variety of different trainings and skill sets, certifications. We have our own internal certification program. So we have the care coordinator, we have the 2 CRAs, we have an addiction psychiatrist. We also introduce pretty early on, and within the first phase, about week 6 to 8, a licensed marriage and family therapist. We introduce him or her onto the team to work with the family. So that person becomes a part of the treatment team. We also invite all of our clients to participate in therapy, because the research shows that, if people do therapy concurrently with any program, their chance of success is greatly increased. So the therapist that works personally with the client also becomes a member of the treatment team. So there's quite a few.
Didn't you also have a nutritionist?
We do. We have a nutritionist on staff.
And you had, if I remember correctly, we visited with you guys for several hours not so long ago, and it was just fascinating and clear to me that this is the model of the future. So I really am very excited to be able to share this with, everybody out there, so that they know that this exists. But you also had recovering addicts as part of the team, helping current addicts.
Yes.
And that seemed to be therapeutic for them as well. So it was a full circle approach. Yeah.
That's right. Because really what's key, I think what we do in the beginning is the team helps the client find out who they are. Because people that come to us typically have been drinking or drugging for years and really lose touch with who they are. So that's really what we do in the beginning. The team will help them find themselves. What brings you joy? What brings you pleasure? In the beginning, people have no answer to that. 6 weeks in, we start to kind of unravel the onion. A lot of what happens within the first few weeks of our program is just developing trust and rapport. Because we're with them for a full year, and we're not going away. We keep showing up, so that the trust is key.
And you've had tremendous success, and actually Anthem is paying for this now?
Yes. We have a wonderful working relationship with Anthem Blue Cross Blue Shield in Connecticut. They've been very supportive of us, and they cover our services for a full year. The client is responsible for a copay and the deductible, and that's it. So it's really a tremendous, and because of that, we have grown rapidly. Again, 3 years ago, it was just me driving around the state of Connecticut, and now, we have 19 care coordinators and I think maybe 50 or 60 certified recovery advisors. and a whole host of supportive staff, including the nutritionists. We have a licensed marriage and family therapist on our staff to consult with us. And we have our addiction psychiatrist at the helm of the ship. We have personal trainers. We have a yoga instructor. We really embrace the holistic alternative practices. And we're always looking out into our communities to find those alternative holistic practices to help support our clients as they journey their way through their recovery process.
It's it's very much a wellness-based program. We talk a lot about, we develop early on a wellness plan with the clients, and they have the input. They get to decide what they want to work on, what their wellness goals are, and then we can adjust. The beauty of the program is that we do have a curriculum, but we can be creative, and we can expand that out into customizing for the client's goals, what they want to work on, whether they want to. Whether their goals are physical, to get back to the gym, or sometimes we'll meet in a library. We can be, we don't necessarily have to sit around the kitchen table. We can go for a hike. It's really about modeling wellness. That part of the program, we model, and the recovery advisors are they're models of hope that it's hard, but it can be done. And I love that it is, as Anne said, integrative. We've brought in EFT, we've brought in tapping, yoga, vibrational medicine, and we also encourage those practices among our staff. We walk the talk. We talk a lot about self-care because it's tough. It's tough work out there. You know, it can be very challenging for the staff, and as Anne said too, our client list is growing and growing and growing. And in order to be grounded and to be solid and to be truly present for a client, we have to take care of ourselves. So we do. I think we do an awesome job bringing that self-care culture to Aware Recovery Care, so that we can bring it out to our clients. And that's an awesome thing.
It's fabulous. And you mentioned, and that Blue Cross has been doing some preliminary numbers, Anthem Blue Cross, and that they're seeing some really excellent success rates with your program.
Yeah, we had a meeting with them, and their actuaries have been crunching numbers, and they are experiencing a significant cost savings.
I bet. This is
Yeah,
the way to go.
you know, we learned early on in our early meetings with Anthem that, you know, many people from other treatment programs go to emergency rooms and, you know, help people get on planes to get out of state, and then they get down there, and Anthem, and then the insurance companies are on the hook for big bills, and so they started looking at, well, how can we keep people at home in the state of Connecticut, and it just happened, you know, it's a lot about timing that we were, you know, in the midst of bringing this model on board. And yeah, they've been excellent partners to work with. Yeah.
I should also mention we have now an extension program. So if a client wants extra 6 months of support, Anthem will also support that for clients.
It's amazing.
It is.
It truly is.
Yeah.
Because
It
the
is.
longer, the better. I mean, you have the greatest success rate with the longer amount of time you can
it's
spend
brand
with
new.
them.
That's right.
Yeah.
Yeah.
Yeah, it reminds me of one young woman that was with us. She had a rough go of it, a young woman in her 20s, 2 young children, lived with her mother and her grandmother, had a very unhealthy codependent relationship with the father of the children, and a lot of upset. DCF was involved. You know, it was messy. At month 10, she found her will, or she found her way through it, and she decided that she was ready. And so we we offered her the idea of an extension, and she just graduated from our program, back to school. The children are doing well. She's clean and sober. I mean, I'm just covered with spirit bumps right now. I mean, it really, we see this happen on a regular basis. It's sometimes it's a rocky road. I mean, we have patients that come, or clients that come into us with a great deal of willingness and readiness, and they can, we call it wire to wire, and they find their way through. And then we have some clients that relapse over and over again, and we use each relapse as an opportunity to learn. That's the beauty of having the full year, because you can learn a lot. What happened? What do we need to be doing different? What do you need that you're not getting? Let's look at that. Let's pull it apart. And let's make some changes. And sometimes it's through the tweaking, and it's through those experiences where people really learn to find themselves and their will to kick this thing. Yeah,
it's so important that we come at this problem with from a place of loving kindness and non-judgment, and we show up, and sometimes we have to scrap the curriculum for that day. It just doesn't work, and people just cry out of frustration, or they yell and scream, the trust is built with a person who, as Anne said before, society has given up. It's such a stigmatized disease, and people have given up on them. And we don't give up, we show up. We don't give up, we show up time after time. And people begin to realize that when we say we're here because we value your wellness, they begin to believe that. Even the toughest skinned, and we've had some tough, and when we have the tough ones, the other beautiful part about Aware is that we rally as a team. It's not just the three of us out there, or me out there, or one of our CRAs. We have this beautiful communication relay, and we pull it together. Either Google, Anne's new thing is Google Hangouts, and we get together with our morning hairdos, and we hash it out. We come up, what haven't we tried yet?
Creative problem solving.
Yes, creative problem solving, and we bring our LMFT in, and we bring the nutritionist, and we bring everybody in. What do you think, and what do you think, and what do you think? And it's just an amazing problem solving, something that I haven't heard before. It's like, wow, let's try that. It might work. Or everybody brings something really valuable to the mix and to the solution. That's another really innovative and amazing part of our program. We love it, don't we?
You guys are like a breath of fresh air in the recovery world. Really, I just want to honor you both and thank you for doing this work, because it's so needed. And you can see your passion and the love you have. And you're loving these clients into being, and they're really receiving that, and it's making a huge difference. So thank you.
Yeah. Well, thank you for saying that.
You are.
Yeah.
That's a new paradigm.
It is
It's a new paradigm.
It is. And doesn't the world need that?
Yes.
Now? The world needs that shift into from pounding each other and from a problem point of view to a loving kindness. We're wired for that. We're wired for loving kindness. So
the trauma doesn't have to win.
Trauma doesn't have to win.
It doesn't have to win.
And so much of it is about a lack of connection and fear.
Right.
And not that that's simple. It's not. But it is. If we approach it from that perspective, we can help people. We can help people.
Their stories. What I love most about this is to be a witness to the incredible stories, the incredible places, difficult places, wonderful places people have come from. Their stories, just being in that space, that sacred space for that story, and realizing we're all part of that human thread. We all have our issues and our pain and our problems to solve. Just to hear that story, that being with a person in that moment of vulnerability is an amazing life experience for me.
And I love the way you language it and saying that everyone matters. People matter, and they need to know that they matter.
Yeah.
And that's where we start. That's where we start, with that message that you matter, and we're here. And we're here for a year. And sometimes at that 6-month mark, they're like, could you please just go away?
We're done with you.
Yeah, we get some eye rolling every now and then.
You know what? But
get some pushback.
to speak to that a little bit, what I have seen and experienced is that there are folks that reach a point. Maybe they do go back to work, and their lives turn around, and their relationships, have shifted, and then life feels good and better. And so our being there isn't necessarily helping them at that time. Okay, so we'll get together, we'll bring the whole team together, the client and their family members, and we'll talk about, well, what do we want this to look like? And we can adjust, and we do adjust our program on a regular basis to meet people where they are. Yeah.
It's so important to honor them, meet them where they are. We don't, we don't expect them to mold lockstep into, we lay out our program. Obviously, we have expectations, we have goals, but we customize. We have that creative ability to customize how we get to that place, how we get to that goal that is meaningful. And when it's meaningful, it's sustainable. We're asking people what they need to move forward.
It sounds like common sense.
Yeah,
Doesn't it?
Yeah.
So why did it take this long?
Yeah.
Why did it take this long to come up with this paradigm?
Yeah, it's interesting.
Our healthcare system needs healing.
It does. Because as 20 years ago, when I was going to treatment in and out as a chronic relapser, I was once considered. And I think if I had something that would come into my home, work with me and my family, and be there for a year, what a difference that would have made. It's so beautiful. It didn't exist.
Yeah. And one thing I did want to speak to, just so people can understand, because 365 days. So it's really broken down into 4 phases. So the first phase is very intensive. We're there a lot of visits. 5 visits the first week, 5 visits the second week. Then we drop down to 3 visits, and we're getting therapists, and we're getting them set up with their primary care provider again. We're getting that baseline lab work. We're getting their addictions. So there's a lot of work, intensive work done in that first phase. And then the second phase is more one of, kind of getting into the family system piece and really digging in there and helping them connect with a therapist or the family education and getting that going. And then the third phase is more of, let's really dig into these wellness goals and see where we are. And then the fourth phase is kind of, okay, let's make sure these community relationships are solid and they're set so that you're ready to launch. So I wanted to kind of, show in that 365-day program, it is broken into a series of phases.
Terrific.
Nice.
That's just fabulous.
It is.
Oh, I love it. So, Julie, do you have any other thoughts on something I may have missed? I know we spent about 4 hours with them.
I know, we did.
And it was a wonderful, overwhelmingly positive.
It really was.
It was a fun day.
I mean, we were all jazzed in the car driving home. Like, these are they get it, and it really was a breath of fresh air, because the system it's broken, and the 30-day program has its place, but it can only take them so far. It only took me so far, and then I could go back into my life, and I wouldn't know how to do life. I didn't know how to do life, so I'll go back to what's familiar. So with you guys, it's like you're just immersing them and surrounding them and looking at them as a whole and saying what's going to serve. You're partnering with them, and that's very different. I was told, here, do this, and do this, and then go.
Well, you always have to go home.
You do. You have to go home.
Always have to go home,
So,
and home is different for everyone.
Right.
You always have to go home.
Yeah.
And some people
You go back to
can't go
people, places,
treatment.
and things, and that's, that could be the triggers. What you left could be the problem.
Well, it is the problem.
So, I mean, that's where the problem started.
Yeah.
Family of origin, for sure. You're bringing them all in, it's all inclusive, and it's an opportunity for the whole family to heal.
It's tough.
Because it's not just the addict that has the problem. It's
Right.
It's not.
Right.
Yeah.
The addict becomes a scapegoat of the problem, right? So you're going in there and seeing, like, okay, what's happening here? And then it's not just such a beautiful opportunity for everyone to partner and join together and work through it.
Right.
Yeah,
we were speaking a little bit earlier about some of what we've seen to speak to your comment about the family system and how it is all affected. And I worked with a beautiful woman who really got recovery right off the bat, and she turned her life around, and her life was unmanageable and out of control. She was a very sick, beautiful, very sick woman. And as she began to get well, her spouse did not know how to deal with who is this person. What do we do now? The whole relationship was turned inside down, upside down.
well, dynamic changed.
Absolutely, and that became a stressor for her. So we were there observing. We were speaking with the family systems therapist who was on the team. Reporting what we're seeing. Getting some advice as to what we can do there, and we did end up helping them find a good family therapist, the couples counseling, so that was very helpful. But it's a great example of what you were just speaking to, that, that it is a family problem,
Right.
challenge.
It's not just the addict,
Right.
No.
so.
So people in the community who are watching this now, I mean, how should they get a hold of you, and how does the whole thing work? What's the practical nature of signing up, or how do they get help for their loved one?
Okay.
Well, we're on Facebook, and we're on the internet, and it's awarerecoverycare.com, and people need just to make a phone call, and they will get somebody in the office and speak to an intake person, and it's not a difficult process.
We have a really beautiful intake team, people that have personal experience themselves, and they get it. Non-judgmental, very safe, and they're also very good at helping people. Someone who makes that phone call may need detox, so they will help them. Partner with them right up front to get them the help that they need. And once we determine whether, it's a good fit, they run the insurance and they do all that. It can be a pretty quick process, 24, 48 hours. And, we'll put a team together and get it going.
If somebody doesn't have insurance, what is the protocol? Is it then it becomes like a cash pay, self-pay?
Yes, we do. That's a challenging part. We do have, it's private pay. We do try to get insurance. We're out of network insurance, and sometimes we're very successful. Other times not. It's totally up to the insurance company. So we really, can't make promises, but we have a team of people that work hard to get that reimbursement if possible. We do have a connection with a a way to pay a loan situation. We also have a 3-month program. So, because some people who have been in treatment, maybe they don't, the idea of the full year feels a little bit too much, so we offer them a 3-month program. You were involved with one of our clients.
Right.
As a practitioner for someone who signed on for 3 months. So that's also an option, and that would be, there would be a series of payments that are collected for that.
Well, it's probably cheaper than the in and out hospitalizations.
Yeah, it
I would
is.
imagine.
It's a lot cheaper.
So it's worth doing.
It's a lot cheaper.
Sounds like it's worth doing, even if it is private pay.
And we do have other insurance that we're speaking with on a regular basis. So I think that
Once the numbers come out.
my vision is
Yeah.
that we're on our way. I think that it just makes sense. I mean, the numbers are the numbers, and if the insurance is all about saving money and we're cost savings, then it makes sense to me that they'll be partnering with us. That's what we're looking forward to.
That's excellent.
We're seeing that the 30-day model is just not enough.
Yeah.
So
Well, the
many of our
brain doesn't have a
clients.
chance to recover yet
Right.
at 30 days.
Right,
You need at least 90 to 6 months
Right.
for you to start to think.
right, right.
So
And I have clients on my case list. We are their 14th or 15th attempt at sobriety.
Yeah.
Right.
yeah,
So add those numbers up.
Yeah.
it's just unbelievable.
And the time. It's enormous. It's mind-boggling when you think of the average program. I don't know what insurance reimbursement is, but an average program could be $35,000 to $40,000. Some are way more expensive than that. And when you think we are, I have a client now. We are the 12th. We are his 12th attempt.
Wow.
Yeah. So when you think about that, that's just
It's
like,
staggering.
wow.
Yeah.
And it doesn't work, and so it's over and over. So it's time for something new,
Right.
Yes.
Right.
Indeed.
Exactly.
clearly.
Yeah.
And so now you mentioned that you're also moving into New Hampshire.
We are. We have an office in New Hampshire, in Bedford, New Hampshire, which is southern. We're fully staffed and up and running up there. We have, Anthem Blue Cross covers us up there. So that's been really exciting, to take what we've created and developed here, which is a mature program. Now, we're replicating it, we're bringing it to New Hampshire. We're looking at Maine, we're looking at Florida, we're looking at Missouri, all within the next year or two. So we're going national.
Florida is a horrible problem.
Yeah.
Yeah.
They really do.
Yes.
Yeah.
Right.
So that's
We're in conversation with the folks in Florida who they want us, and we're working right now on how's that going to work? What does that look like? Yeah.
so. It sounds like you're growing considerably, and probably will have some neat opportunities for employment.
Oh yes.
So if there are nurses out there,
Oh yes, holistic nurses.
Yes,
we love
holistic
you.
nurses, yeah.
Nurse practitioners, psych nurses, social workers, people who have experience working with folks in addiction. Call us up. We need you
recruiting,
now.
active recruiting.
Yes.
But this is so perfect, just what's needed at the right time. Right time.
Yeah.
Julie, how did you find these wonderful ladies?
Well, I met Anne through an old childhood friend of yours.
Yes,
Who,
next door neighbor.
yeah, and I worked with her son, and helped him with some addiction issues, and then we just connected, and you wanted to learn more about EFT,
Yes.
emotional freedom techniques,
Yes.
and you wanted to tap with yourself and your own self-care, and then bring it to your staff.
That's right.
Then I met Dorothy,
Yeah.
and then I did work with one of your clients for a bit.
That's right.
Yeah,
Yeah.
so
And now Ann and I are learning so that we can bring it to our
Yeah.
clients.
yeah, so
That's
they're getting
excellent.
certified in
Yep,
it.
yep,
Yeah,
yep.
It's a valuable technique. like
Yeah,
Julie
yep,
did.
it is.
yep. It's
beautiful.
portable. It's great for we're learning from Julie that the benefits for trauma release, and most of our clients have a trauma history. So
I don't think I've met an addict without a trauma history.
yeah, so it's something quick, easy, and that we can teach them for their self-care too. So any of those tools, any of those modalities that we can bring into the home and help our clients are, they're just, we just love that stuff. It's just, it works. It works. It's evidence-based. It works.
And you mentioned earlier that you had a brush with trauma yourself.
Yes.
And so that you have a special feeling and connection with your patients.
Yes, yeah. I think we in life we all have stuff that unpleasant things that we remember. And I was explaining to you, it had to do with guns. In a situation where I was working and I was a teenager, and the store was robbed, and there were threats and guns, and so yeah, you don't that becomes part of you, and but it's a part of my history that I use in a way that I can connect. I don't have to know what the trauma is, and the trauma doesn't have to be identical, but I can connect with the feeling and the sense and the need to shift it to a place where it's manageable for people, because sometimes that's exactly what's driving their drug use or their alcohol use. So it's really it's a vulnerability that I deeply understand. So yeah, it becomes a tool for me. That experience doesn't have to stay painful. It becomes a tool. So
A gift.
yeah, a gift. You make it a gift.
You do.
And you give
Right.
away what you learned by it,
And it helps heal you.
Yeah.
You heal from that.
Absolutely.
You know?
Absolutely.
So it's
We're all on that human thread.
yeah.
We're all on that thread of the need for safety and understanding and belonging and acceptance. All of those things that we all need that on some level. So we're not any on a level. I am no different. We're all the same. We all belong to humanity at that level, and when we can get our clients to understand that, it's not an us and them. It's a we. We work on this together. We walk this walk together. It's an awesome thing.
Yes.
It's an awesome thing.
What inspired you ladies to go into holistic nursing?
Well, for me, I've been a nurse for 35 years. I was trained by the beautiful Sisters of Charity in New York City, and the School of Nursing is now closed. But what I realized during my training, I didn't know about holistic nursing, but it was very, our training was very holistic. I worked on the wards in St. Vincent's Hospital, where there were 12 beds in a room, and the basis for the work of the Sisters of Charity was to work with the indigent, uninsured, homeless population in New York. So that's where we did our training on the wards and I lived a very sheltered life on Long Island, and then I moved into New York City and was scared to death, but learned. I've never seen in all of my years what I saw in New York. And so as I moved forward in nursing, different specialties, there just was that piece. It just kept getting more and more watered down. That connection with the patients and the clients, and increased productivity with doing more with less, and working shifts and no breaks. And I love nursing. It's who I am. And I had to find a way to bring that piece back. I had to find a way to bring that caring and that presence and that the meaning back for me. And that's how I found this wonderful holistic program. It's called Birch Tree. And it was, you know, we get to where we need to be. We find our people eventually. We get to be where we need to be. And I found Birch Tree, and that's all she wrote. It was where I needed to be at the time. It was a year journey with Birch Tree, retreat-based learning for holism, and I've met the most amazing people, and the most amazing people just keep showing up, like you and Julie and my buddy Ann and all the people that I work with and my clients. I include them in that circle of amazing people. So yeah. And it's been amazing ever since. Yeah.
Well, that's wonderful, Dorothy.
Yeah.
Wow. And Ann, tell us about your...
Yeah, so, you know, one of the first comments that my preceptor had for me in the hospital setting as a brand new nurse was that you spend way too much time with patients, way too much time, you know, because I'm on their beds holding their hands and talking to them. Because for me, I wanted to hear the story. And I realized very quickly that I can be no other way as a nurse, that this is where I need to be. It was a strong message that, you know, I had no choice. This is who I am and how I will be. And, you know, the Florence Nightingale, one of, you know, the mother of nursing, I mean, she was such a holistic nurse and not bringing that therapeutic presence. And I got really interested in her, and very quickly found holistic nursing through the International Nurse Coach Association, where I connected with holistic nurses who were basically training. I went through this training program to become a nurse coach, where we learn to co-create the sacred space and help people to really, you know, be who they are with us, and help people to be their authentic selves, and knowing that everyone has the answers inside themselves already. So our job as a holistic nurse coach is to help them find those answers. And I believe that's key to another paradigm shift in our healthcare. I think we need more nurse coaches to help people with those decisions and lifestyle changes. Holistic nursing is really it's a spiritual experience for me, in that, you know, I'm very dedicated to my self-care practice, because I know that to bring my best self to my staff and my clients, that my cup needs to be full. And I learned that in my holistic nursing program. I also was introduced to aromatherapy, clinical aromatherapy, drumming. You know, I'm a big believer and practitioner of, you know, vibrational healing. I love it. My kids think I'm crazy. What's Mom up to now? What are all these djembes doing in our living room? I discovered Reiki through my travels, and so I spent some time, and I got certified Reiki 1 and 2. I love that work. I'm just drawn to it because I believe that healing that the spiritual component is necessary for healing. That, you know, healing and medicine can and do live side by side. Mm-hmm. I'm much more interested in this piece than I am in this piece, because I see, and I've heard stories, miraculous stories of, you know, cancers disappearing in the face of, you know, visualization and guided imagery and crystal bowl vibrational healing. I mean, it happens, and I love it, and I'm drawn to it, and I can't get enough of it, and it brings me joy, and I'm so fortunate to work in this amazing company that really inspires me and has given me the space to practice, you know, to bring my holistic practice to the workplace. And, you know, to share it with others. It's really a gift that Aware Recovery Care. I mean, they're very open. Steve, our founder, and his partner Matt are incredible people that have, they believed in this model, they brought it forth, and they're wide open to what might work. And it's a little different. Okay, let's look at it. So they really are movers and shakers in this, this new model. They're the ones that have made it happen, and they're also the ones that are very open to the creation and development of a new innovative way of being, and holistic practices are part of what we do at Aware Recovery Care. So,
Oh, that's fabulous. And it's right along the lines of how we practice medicine too, and have practiced forever. The same kind of thing, and you have to spend time with the person.
that's right.
That's the whole point. You have to hear them out, and half of the healing is just talking, actually, listening.
Listening.
Yep.
Yeah, that you matter.
Yeah.
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 And your story matters.
Yeah, that's fabulous.
Yeah.
So is there any kind of, there's no denomination, religious denomination, or any limitation in the program? It's just purely like holistic, spiritual.
Absolutely. Yeah.
Biopsychosocial, we address the whole person. There are programs like AA, for instance.
That's what I was
yeah,
wondering.
yeah. There are people that it just doesn't resonate. But there's also refuge recovery, which is a beautiful approach to the 12 steps. It's Buddhist based. And there are several programs in the state. I've actually been to a couple of the meetings. They're very meditation based. There's smart recovery, where it is not at all secular in any way. So that's
Very goal oriented.
it's very goal oriented. I think part of one of at least my own goals with clients is to get them to understand that spirituality is not religion. That we all have a spirituality within us. It's really what gives you joy. What causes that thing, that feeling inside of you, whether it's nature or spending time with animals or artwork or music. What just makes that thing bubble to the surface in you, and that's spirit. So we don't subscribe to anything in particular. It's what resonates with the client, and we just expose them to things. We try to expose them to as many ways and means and modalities and theories, and let them choose and decide. We try to get them there. The CRAs they're just amazing. They'll go to meetings and just for the experience.
Yeah, we love 12-step because it's everywhere and it's free.
Yeah.
And there are people that have had bad experiences there. And so the key for us is to help folks find a community, wherever that is. So it's really about community and belonging. And that can be in church, it can be in your dance class, your yoga class, it can be with your 12-step community, it can be school, it doesn't matter. But we do work very hard to help people get connected to something, because we all know here that when you sit at home without a sense of purpose, and a reason to get out of bed and turn the television off, that the chances that you're going to be successful in being able to say no to the drug are slim. So it's about action, movement, getting out, moving.
Right. Yeah, totally.
Yeah.
Well,
It's a huge
the
difference.
connectivity is very key, and actually it's so online with what we believe. We have formed a nonprofit for reintegration of veterans and retraining in agriculture and forestry. And the whole premise is the retraining is going to happen, but it's really creating that network for a vulnerable population to keep them out of self-medication.
Yes.
You know, so I'm expecting to see some indirect lowering of cases, addiction cases, doing this. But it's the same principle. We're going to be including kids and seniors eventually, different arms of it. But it's what our society is missing. We were fragmented.
Yes,
Yeah.
isolated.
Yes.
Little pockets.
Yes, yes. There are ways that technology has really connected us, but there are also ways that has really taken the place of a face-to-face conversation and that human connection. And that's a worry. That's a
Well,
worry.
the statistics, I heard, so, research is showing that people are lonelier than ever. And, the face-to-face, the Facebooks, the social media, it's lonely. It's a lonely place.
Yeah, it's not a substitute for inclusivity and the net.
Right.
There's a wonderful YouTube video. It's short and it really hit home for me. That the opposite of addiction is not abstinence. The opposite of addiction is connection. Yeah. And it was connected to an experiment with rats.
Rat Park.
Rat Park.
Yeah, I've seen
exactly,
it. That's
exactly.
good.
And if you Google or if you go on YouTube and just search Rat Park,
It will come up.
It
What
will
is
come
it?
up.
It's a TED Talk.
It's a TED Talk. Yeah.
I don't know what that is. I don't watch TV.
Yeah.
I'll send it to you later.
Yeah. Yeah.
It's really good.
People out there know.
We could probably
that
show
it's
it.
it's a TED Talk. Yeah.
Okay.
Yeah.
That's a good idea.
Yeah. It really it hits you pretty squarely,
Yeah.
and that we need, and again, it's that human connection that and it starts the first day in the home with the family and the client and pulling them in and then walking the walk
Right. And being there with them and not
and being there.
abandoning them when
Exactly.
if they relapse or something goes wrong. And
Yeah.
so that's what the gentleman doing the talk was. He was had family that was suffered with addiction, and he wanted to figure out how to help them and how to So he went on a mission and he traveled the world, and went over to Europe to see how, because they decriminalized all drugs, and they were intrigued. He was intrigued by how that could solve the problem. And I'll send it to you later because it's very beautiful. And,
Sounds good.
Yep.
he talks all about just connecting
Yeah.
and being there and listening to them talk and listen to them struggle
Yeah.
and not run away from it.
Yeah. Yeah.
Like it's
Yeah.
okay.
Yeah.
Holding the space.
Holding that space.
Holding the space.
And we can't end without saying there's some humor. We've really met some of the funniest. I mean,
This is true.
I've had some of the best belly laughs I've ever had with some of these amazing people who are struggling so much in life, and it's just there's that too, and we really honor that. That there's a part of people are funny, situations are funny, and the day I got into it because this kid wouldn't help me shovel out my car, it turned out to be just a funny situation, and we were standing in the driveway in the snow. We're all laughing, and laughter is medicine too.
And didn't you go over to a client? He wanted you to come see his motorcycle, and you went over and sat on his motorcycle in the garage. I mean, that's funny.
Yeah, for me, that was pretty. No pictures of that, darn.
That would have been good on Facebook.
It wouldn't be good on Facebook. No, yeah. So
That's a good point, though.
Yeah, laughter
Yeah.
is medicine too, and we try to do our share of that.
Yeah.
Nice.
Wow, that's excellent. Well, so if a patient is in the hospital and they're ready to reach out to you, they can call personally, or their coordinator can call you,
Sure.
and go from there, and you'll
Yeah.
streamline everything else.
Yep. The best way is to the www.awarerecoverycare.com, and our contact information is up there. And we have a great team, intake team, people that really get it, and kind, and if we can't help, they'll help find somebody who can.
Perfect.
Yeah.
Perfect. Well, wonderful. Thank you very much, ladies.
Thank you. This has
Anna,
been
Dorothy,
very
wonderful.
fun.
Julie,
Yes.
Aware Recovery Care, the new paradigm in addiction recovery.
Thank you.
Thank you.
Thank you.